Hi, it's Dr. Kate with another podcast episode, and this one is going to be about pre and postnatal care with chiropractic. So I have a brick and mortar chiropractic practice and see patients in the office every week, and one of the niches that we do here is pre and postnatal care for patients, and some people that aren't familiar with it might not put together why that would be a good thing to do. So I just wanted to talk a little bit about how that helps the pregnant and new mom demographic. With prenatal care at the office, there is the standard main technique that chiropractors use for that newly pregnant mom, and that's called Webster Technique. And it's a phenomenal technique for pelvic balancing, and you can learn it through the ICPA, which is an association through chiropractic that does lots of continuing ed. That's great. I've taken lots of their coursework. It's a phenomenal resource for chiropractors. And it is a pretty non-invasive, simple technique that you can use not just at the end of pregnancy, but throughout to keep the pelvis balanced. A lot of people think of it as the baby flipping technique, and we talked about that in the podcast that goes over how to help flip a breech birth. But it's also good throughout the entirety, because you want to have a nice balanced pelvis throughout the entirety of your pregnancy so that the baby has lots of room to move and develop, and you have all these ligaments suspending your uterus within your torso, and if they're attached, some of them are attached to your pelvis. So we want the pelvis moving easily and symmetrically so that the uterus doesn't get shifted or torqued to one side or the other, because we want that optimal positioning all the way up until the end. And then the end is where we want the baby to have enough room to move the way that they want to and need to, which would be to go head down. So that is that classic technique. Lots of OBs and midwives recommend that technique for their patients because they know how good it is for the proper positioning of the baby. Now that's the more chiropractic side of things. And the other thing that I address for patients when they're new moms is that the Rehab Prehab pelvic floor niche that I started to get into when I was pregnant with my first child, my daughter. And that started my journey into studying dynamic neuromuscular stabilization, and then visceral courses and pelvic floor coursework as well. And I like to have patients start that while they're pregnant, because it makes your recovery so much easier instead of just waiting until you have the baby to have some of those tools in your tool belt. So I love to give pregnant moms some of the core work and beginner stuff. So, obviously you don't do sit-ups and that kind of thing when you're pregnant, but this different core work and more stabilization of your torso and that kind of thing is a great precursor to help you labor and delivery more easily and recover more easily. And even if you have a C-section, it still helps on the recovery end of things. And that, that's the goal, because then your baby is here and you want it to be an easier recovery time so that you can put your attention on that rather than, you know, trying to navigate and wade through all these crazy changes that happen once you have the baby. So I give all my patients exercises to really like thinking of birth as the most intense physical event you're training for, that you're going to do in your life. Because no matter what way you look at it, no matter what kind of birth you have, it's going to be intense and, you know, difficult, whether it's fully natural or epidural or C-section. It is going to test your limits. And I think thinking of it like that and thinking of it like training for a marathon is important and helps you long term. Plus, then you kind of know what you're going to step into slowly with all the breath work and that kind of stuff afterwards. And, you know, we did a podcast on Diastasis Recti earlier, and lots of people have diastasis, which is the separating of your center line of your abdomen when they're pregnant, because just the expansion, that room that, you know, like there's just nowhere else for it to go. But we work on nice lateral expansion of the rib cage and breath work while you're pregnant, so that you have as much space as possible for the pressure to go rather than separating the abdomen like that. And it's a great training for when you have the baby, because a lot of people get diastasis recti. They can get it after they have a baby too, because your core is vulnerable, and if you don't have these tools in your tool belt, you're susceptible to those kind of things even after you've had the baby. So we work on the breathing and rib cage mobility and the core work, but not your stereotypical core work. That's, you know, helping to integrate your core in a lot of different ways. I try to get my patients to do, when they're pregnant, to do a lot of pelvic unweighting, or getting the hips above the baby or the uterus, so that we can take some of that gravity off of the pelvic floor. Because lots of people have pelvic floor issues even if they've had a C-section. I think people have this misconception of pelvic floor issues only occurring when you push a baby through the vaginal opening, and that's not really where the dysfunction comes in at. It can, and that can be, you know, you can have severe tearing and all of those things that would cause issue, but the other issue is simply the weight of the placenta, the baby, the amniotic fluid, down on your pelvic floor for 9+ months. And that pelvic floor is a muscle, and it's eccentrically contracting to hold everything up, and it can cause spasming. So even if you've had a C-section, you don't get a free pass on any pelvic floor issues. So I try to help them to learn techniques to relax the pelvic floor, get that weight off of the pelvic floor, just to give it a breather multiple times throughout the day, because that's important in helping with pelvic floor issues after you deliver as well, because, you know, nobody wants that, and it's easier to start earlier rather than later. It's not impossible. I work with people, you know, years and years and years after they've had babies for pelvic floor dysfunction, but it's always, of course, easier to start earlier. So that's kind of the stuff that we do with patients, you know, prenatally. Plus they have, you know, SI pain, low back pain, headaches are common, those kind of things that we address as well. You know, just like regular people stuff, but just exacerbated by all the demands you're putting on your body. So that's pre-baby. And then post-baby, we have pelvic floor issues. We have the C-section stuff, usually I have people start working on their C-section scars themselves right away, and you can do it with breathing. I know that doesn't sound super, it doesn't have to be intense to make it a change. So we start with breathing. Once the scar is healed, we can move the skin around it and walking them through those steps to help gain mobility. Because when you touch around your scar, whether it be a C-section or any abdominal scar, you want the skin to be supple and move super easily, just like skin anywhere else on your body. So you want to work through those adhesions and those sticking points. So, and we want to think of it as layers within. So you want to be able to do the superficial layers and the middle layers and the deeper layers, because you can even have some adhesions forming onto other things, and making sure that we work on all the different layers in all the different places so that we get that core function back. Because if the brain isn't viewing that area as well as others, then it's not going to be, you're going to feel disconnected from your core. You're not going to be able to build your intra-abdominal pressure properly, and then that can lead to pelvic floor issues like leakage and that kind of thing. So they are intimately tied together. So postpartum, for C-section patients, we help them address their scars. Then I will address their scars, and just walking them through that consistency of slowly becoming accustomed to working on it, because a lot of people have some pain, numbness, that kind of thing with the scarred area. And for patients that have had natural childbirth, we see the pelvic floor issues as well. They could have had tearing, and tearing is a scar of its own too, so it needs addressed just like a C-section scar. So how do you slowly motion that area so that you don't have pain with defecation or pain with sex or inability to use a cup or tampon afterwards, all those things. It's a scar like any other, and you want that skin to return to its suppleness that it had before. And then obviously the breathing, and then we're at that point where do we have a diastasis recti? How do we address that? Do we have like a poor connection with our core because it was expanding. You deliver, it totally deflates, it throws off the pressure balance, and gaining that back and walking them through the stuff that we did prenatally and slowly building upon that. But it's a process, and it's a long, slow process, and it doesn't help you to try to speed it up or jump ahead, because if you jump ahead, you can make your diastasis worse. And there are some benchmarks and that kind of thing that you want to hit before you try other things. And it's, like for example with running is something that is difficult. It's one-legged, and you have to earn the ability and the strength to be able to do it well and properly. So that's important, and you don't want to cause more issues or different issues on top of that. Another thing I see a ton with new moms as the stress and anxiety, that kind of thing. It causes us to hold tension up in the neck, down in the tailbone. We can either clench in either one of those areas, and it causes other musculoskeletal issues. So we work on the breathing, of course, because not only does that help your core, which is important, it also helps downregulate your nervous system. So helping with that anxiousness and stress and postpartum issues, depression and anxiety can range from very, very minor to very, very severe. And you don't want to downplay any anxiety you have because you think, oh, this, so many people have it worse. It doesn't matter. It's your own story. So you want to not minimize it and be able to find some tools for yourself to help downregulate your nervous system. And then, if that doesn't work, always reach out to those excellent partners and stuff to help in other ways, whether it be counseling or whatever path you decide to take. Another big one, especially for me, and I don't know if it was a mixture of, being super anxious or I'm just in general prone to stress, headaches, and that kind of thing. So nursing and that rounded forward posture just wrecked my upper back and created headaches and stuff. And doing, getting treated and doing different exercises were so key in making me be able to be present for my kids because, if you've had headaches, that sometimes you can't really function when you're having just an intense headache or migraine or that kind of thing. So I think it's important to get new moms feeling the best they can because it is rough being a new mom and you might be sleep deprived and you don't want to be sleep deprived and in pain as well. So that is definitely our goal. Is like there's so much to address with the postpartum mom. I would say even more than prenatally. It's super important prenatally, but that postpartum area, whether it be your pelvic floor, your diastasis, your C-section rehab, your headaches, your anxiety, your stress in the upper back, maybe I've had people come in with residual pain from epidurals. There's just so many facets to what needs addressed, especially when you're, having hormone shifts and lack of sleep and trying to keep this new life flourishing. So it's definitely something that I love. I love working with the pre and postnatal moms in the office, and everyone's journey is so different. And I think that's the biggest takeaway, I think, for me, working with that demographic. And it's even different for patients baby to baby. So one woman's journey could be very different for her first baby versus her second or whatever transition. And that's making sure that you have a nice toolbox of resources because you never know exactly how it's going to go. So I love to be that for people. And, I know the drop-off rate from, people are pretty good about coming in prenatally or especially if it's their first one, because they can do all the things and not need to cater around kids' schedules. And then once they have the baby, it's all about baby visits and everything. And it's easy to let yourself kind of get put to the back burner. But because of that, I started to build a pelvic floor, C-section, and diastasis course that will be a monthly resource for people to do. It should release by October 1st, and it is a monthly program, and it walks you through those steps of scar release, breathing, core work, integrating it into mobility work, and making it an easy half hour each day that you can do and just day by day, and then reassess, see how your symptoms are, and then decide whether you're ready to move to that next level of intensity. So just another option, because I know that it's really hard for some of my postpartum moms to make it into the office, and I wanted to find something that is accessible for them too. And yeah, so if you have any questions, just let me know. You can email me or drop a comment, and I would love to answer. So have a great day.